Hey you guys, welcome to my channel. I'm Pharmacy Tech Love. This is where you're learning everything that you need to know about how to be a pharmacy technician. Hey, welcome back to my channel. Where have y'all been? No, like, where have y'all been? No, I'm just joking. But as far as for me, I have been working, as you guys know. First, let me introduce myself. I'm Pharmacy Tech Love. If you have stumbled upon this video, then you have stumbled right. If you're here to learn about how to become a pharmacy technician or how to become certified in different areas as far as the pharmacy technician, then you are in the right place. But first, what I want you to do, go ahead and make sure you subscribe to my channel. Hit that little bell right there. Make sure you, whenever you subscribe, you hit the bell, and make sure you hit the one that's got the little quotation marks around it, because I want you to be able to watch every single video, and you won't be notified unless you hit that bell that's got the quotation marks. So anyway, so I hope everybody has been doing well. I haven't been on my channel in maybe, if I took a guess, I'd maybe say a month and a half. I'm really not sure, to be honest. But it's been a long time since I've been on my channel. I've just been working. As you know, I do work a 9 to 5 at a hospital. I do teach at a college, and now I just added another college on to what I'm already doing. So I'm just trying to stay busy because I just like to stay busy. If you would like to become a certified pharmacy technician, I do have a link to my page, to my web page. I'm not going to do any editing, you guys. So I do have a link, and you will receive a 5% discount code if you want to check out my director's platform. She does have a YouTube channel. It's called Pharmacy Tech Lessons, and if you want to check that out, you can. But like I said, if you want to become a certified pharmacy technician in 60 days, definitely check out my page. Take advantage of that 5% discount code, because it does help out. What I normally try to tell people, if you get the 5% discount code, it's best to just go ahead and pay the whole amount up front, because that takes off like $60. But if you do the payment plan, it only takes it off, that 5% only takes it off one time, which is like 10 bucks. So save 60, save 10. It's really up to you. So today we are going to talk about medical suffixes. I've started actually trying to create a lot more videos for my students, because it's so much easier for me in class to show them these videos instead of, you know, when they leave class, they may not get it all because we're only there for a certain length of time, and not have to cover other issues, or not other issues, but just other things that we, you know, talk about in class. So if you need help with your medical suffixes, here's your opportunity to gather this lesson plan. So let's get right into it. Okay, you guys, these are medical suffixes, okay? So this is what you're going to need to know in order to kind of help you remember what the medication is used for, and this is the suffix of a medication. I also listed some of the medications that end in this suffix, okay? So let's talk about the first one. So the first one is going to be in a drug ending in the last suffix of a meal. One of those suffixes is verapamil. The medications, most of the medications that will be ending in a meal are going to be calcium channel blockers. And what calcium channel blockers do is they decrease blood pressure in patients with hypertension. If you don't know what hypertension is, it's just high blood pressure. That's all hypertension is, okay? And we all know that high blood pressure is a silent killer, okay? The next one is going to be cane. This is going to be medications that end in the last 5 letters of cane, okay? And these are local anesthetics. Anesthetic is a medication that causes the absence of pain sensation. An example of those are bupivacaine, lidocaine, and marcaine. There's a lot more, but I don't have that much room to write all of them. Okay, so those are examples of canes, which are local anesthetics, a medication that causes the absence of pain sensation. That's bupivacaine, lidocaine, and marcaine. Okay, let's go on to the next one. And of course, you can always rewind, fast forward this video if you need to study this, okay? All right, the next one are words or medications ending in "ide." Okay, these are going to be oral hypoglycemics. What they do is they lower glucose levels in the blood. Some of those examples are glipizide, glyburide, and glimepiride. You all see the "ide" right there, IDE, and they lower glucose levels in the blood. Okay, let's go to medications ending in oxazocin, and this is just going to be a broad spectrum of antibiotics. Okay, antibiotics are drugs used to treat bacterial infections, not viral infections, bacterial infections. Examples of those are oxofloxacin, oxlazoxin, Here's ciprofloxacin, and then we have levofloxacin. Okay, make sure you rewind this back and take a look at these. Let's go on to our second set. Okay, you guys, this is our second set. So let's get back into the medical suffixes. The first one is going to be mycin, okay? And these are antibiotics. They are used to treat bacterial infections. An example of that is gentamicin, okay? All right, the next one is olol. These are the suffixes. So suffixes mean that's going to be the ending of a word. Prefixes is the beginning of a word, okay? So the next one is olol, okay? That one is a beta blocker, and beta blockers cause your heart to beat more slowly and with less force, which lowers your blood pressure. So these are medications for blood pressure, okay? And it is a beta blocker, okay? Examples of that is atenolol, bisoprolol, metoprolol, and propranolol, okay? All of these have in common the OLOL again, and OLOL again, okay? All right, the next one are going to be our PAMs, and these are anti-anxiety medications, all right? And these are medications or other interventions that reduce anxiety. So examples for that, or a list of those medications, is lorazepam, diazepam, and temazepam. Okay, I have taken temazepam before, and it gave me really, really bad hives. All right, the last one on this list is going to be the SONE, S-O-N-E, okay? These are going to be steroids. They help inflammation, all right? They're steroids. Ending in S-O-N-E, they help inflammation. An example of those are going to be dexamethasone, hydrocortisone, and prednisone. All right? Okay, this is our second set. I believe we have 2, maybe 3 more sets to go. So let's get into set number 3. Okay, so this is our third slide right here. The first one is going to be VIR, okay? And those are antiviral medications. They are used in preventing the growth of viruses, okay? Some examples of those medications are acyclovir. See, you have the VIR, and this is the suffix, VIR for viral, or viruses. Oseltamivir, valacyclovir, all right? Okay, the next one is going to be Zide. It's going to be Zide, which is a diuretic. These are used to rid the body of extra fluid or salt. There are several different types of diuretics, okay? Thiazide, this one is hydrochlorothiazide. It's a very long word, so I didn't feel like writing it all out. Then you have chlorothiazide, okay? Z-I-D-E, hydrochlorothiazide, and thiazide. And these are in the Zide family. These are diuretics, okay? The next one is Neum. Oh, this sounds kind of funny. These are neuromuscular blockers. And they produce paralysis, meaning they paralyze different areas of the body, okay? All right, and I believe this is, yes, the muscular area of your body. This is where that's going to cause paralysis. And in order to produce that, we're going to use the medications rocuronium, vecuronium, all right? The next one is going to be Mide, M-I-D-E. This is also a diuretic just as well as that was. Mide and Zide, okay? These are used to rid the body of extra fluid or salt. Examples of these medications are furosemide, torsemide, and also indapamide, okay? I've never seen this one used in the pharmacy before, but doing a little research, I did find that one. Okay, we have 2 more slides to go. 2 more slides to go. All right, see you guys in just a moment. Okay, I think this is our 4th slide, I think. Okay, so the first one that we're going to get into is mycin. Mycin. And these are antibiotics. These are medications that can help stop infection. Examples of those medications are azithromycin, clindamycin, and vancomycin. Okay, focus on the M-Y-C-I-N, mycin. Okay, the next one that we have is going to be Dine, D-I-N-E, or Dean, it's pronounced Dean. These are anti-ulcer agents, and they're also H2 histamine blockers. Okay, we have ranitidine, famotidine, cimetidine. Okay. The next set is going to be our DONEs, which are opioid analgesics. The word analgesics means pain. Okay. So these are medications that are used to treat moderate to severe pain. I don't know what happened right there. We have oxycodone, methadone, hydrocodone. Okay. Right. The next one is going to be LAM, which are anti-anxiety agents. These are medications or other interventions that may reduce anxiety. We have alprazolam, and we have estalzalam. That's how you pronounce that. Okay. The next one is Pine, which are calcium channel blockers. They are used to decrease blood pressure in patients with hypertension. So this is for blood pressure. We have amlodipine, nifedipine, and nicardipine. So I guess you can pronounce this amlodipine or amlodipine, nifedipine or nifedipine, nicardipine or nicardipine. It just depends on, I guess, where you are on the planet. All right, we have, I think, 3 more to go. Not 3 more slides, but 3 more suffixes. So let's finish these and we will wrap this up. Okay, this is our last slide. You've made it through. You made it through. Thanks for hanging in there with me. All right, the last one is, well, the next to last one is Pril. Okay, and these are ACE inhibitors. Okay, these are used primarily for the treatment of hypertension and heart failure. Examples of those medications are lisinopril and also quinapril. And the last one are statin drugs. In the drugs ending in statin, these are anti-hyperlipidemic medications. They are used in the treatment of high levels of fat. These are lipids such as cholesterol in the blood. Okay, fat lipids are cholesterol in the blood. Examples of these medications are atorvastatin. So this is for if you have high cholesterol. Lovastatin, pravastatin, and rosuvastatin. All right, I want to thank you guys for watching my video. If you do want to become a certified pharmacy technician, that's something that you're interested in, you can look either in the description, or try to place my page link in the comments. Try to pin it in the comments right there. So if you're interested, you can. If you're very interested and you feel like you do want to sign up, but you still feel like you need to know a little bit of something, you can email me at pharmacytechlove@gmail.com. All right, y'all have a good evening, and I will see you next time.